Hi, everyone. My name is Sarah McKendry. I'm an occupational therapist here in Pittsburgh, and most of my work focuses on supporting people living with chronic conditions, things like chronic fatigue, chronic pain, autoimmune disorders, hypermobility. And I've completed a lot of specialized trainings in areas like long COVID, ME/CFS, fibromyalgia, chronic pain in general. And I'm really passionate about helping people who often feel overlooked or misunderstood in our healthcare system. And outside of clinical care, I serve as the director of health career pathways with the Southwest region of the Pennsylvania Area Health Education Center, where I help prepare health professional students to work with underserved communities. I also coordinate occupational therapy services at the Birmingham Free Clinic, working with students and volunteers who are learning what community-centered care really looks like. My interest in health equity started early during my time in outpatient rehab, where I saw how many barriers patients face, especially those from marginalized or underserved backgrounds. It wasn't just their diagnoses, it was transportation, insurance, communication gaps, confusing systems, and structural issues that made accessing care really difficult. And those experiences pushed me to think not only about individual patient care, but about the bigger systems shaping their health. And ultimately, all of these things led me to the Salk Health Activist Fellowship. I wanted a space to understand public health challenges from a broad interdisciplinary perspective. And in the fellowship, we learned from experts across the country, and we looked really closely at how the COVID-19 pandemic exposed system level weaknesses. And we teamed up to kind of reimagine what a stronger, more equitable public health system could look like. And one of the biggest gifts of the fellowships for me was the confidence that it came with, being surrounded by people who cared so deeply about access, equity, and innovation really expanded the sense of what I felt I could contribute. And it pushed me to find my voice, not just as a clinician, but as an advocate. And that confidence carried into my work with AHEC, where I've now had the opportunity to advocate at both the state and national level. I've met with legislators, including U.S. senators and their staff, to talk about issues facing Pennsylvania communities and the future healthcare workforce. And honestly, I don't think I would have walked into those meetings with the same level of grounding or courage without the experiences and the team-based problem solving that I gained from the Salk Fellowship. For me, the fellowship helped connect all the dots, what I was seeing in the clinic, what communities were experiencing on the ground, and how public health and policy shape the entire landscape. It helped me grow into someone who not only treats patients, but speaks up for them. So if you're somebody who cares about public health, who's frustrated by barriers to care, or who wants to collaborate across disciplines to imagine something better, the Salk Fellowship is a really incredible experience. You don't have to be an expert, you just have to have the curiosity, compassion, and desire to help create change. And the fellowship gives you the tools, community, and the confidence to step into that role.